Part three. Okay, now that you're working as a nurse, now you're going to be experiencing some transitions. So what are transitions? Transitions are periods of change. You'll be changing from nursing student to graduate nurse, from graduate nurse to registered nurse. And each of these transitions requires changes. You have to accept and expect changes. Changes in your responsibilities, changes in your experiences, changes in the people around you. When you're a graduate nurse, yes, you're a nurse, but you aren't an RN. Once you pass NCLEX and you're an RN, now you are a full nurse. You can do everything. Know what is expected of you. And understand that one of the first things you're going to feel is reality shock. Reality shock. And what happens with reality shock? Well, first off, it's amazing how you're going to feel suddenly. In nursing school, you've got me or another instructor as your support system, as your backstop, as your security net. And you're going to graduate, and you're going to be, oh yeah, I'm all over that. And pretty soon, the job realities are like, oh my gosh, the workload is going to go up, the demands on you are going to go up, the expectations are going to go up, your emotional commitment is going to go up, and you're going to realize that being a student nurse and a graduate nurse and an RN, they're totally different. Your first phase will be the honeymoon phase. You're going to be excited and happy. Nobody is watching over your shoulder anymore. Trevor's not watching you every time you pass meds now. Yeah, you're the real thing now. And then you're going to have called the shock and rejection phase. And that's when your bad days outnumber the good ones. And this will happen. I don't know when. A month, a year, someplace in between. But at some point you're going to realize that you're having more bad days than good days, or more bad hours than good hours. That's normal. That's the shock and rejection phase. All the excitement has worn off, all that happiness has worn off, and now just the realities of the situation are kind of crushing you. The next step, hopefully you get to the next step, it's the recovery phase. When you find your sense of humor, you decrease tension, you start working more effectively toward finding a solution. That's when you become the most efficient. How do you handle reality shock? Prioritization, constant prioritization and reprioritization. Conflict management, not competition, collaboration whenever possible, and not avoidance. Avoidance is bad. Time management. Find your way of organizing your day and keep on top of everything. And find a support group. Might be other new graduates. Might be people that aren't even nurses. Maybe in my neighborhood, we had a bunch of professionals. We had me. We had a prison guard. We had an EMT. We had a CPA. A guy that owned his own plumbing firm. And we got together every few weeks to just talk about gripes. And it's kind of nice hearing people who are non-nurses have similar gripes to mine, although nobody ever got puked on in their job. So there are 4 groups and the way that they handle reality shock. The waves. Now these are the people who are constantly trying to change things. Nothing is ever quite right, so they're always in there bringing a new idea or trying something new to find the right way of doing things, and they never really find it. That doesn't work very well. Then you have the work days. Now the work days, they come to work, they punch the time clock, they do the job, they punch the time clock, and they go home. This is actually a relatively negative approach to the job. Now, I'm not saying you should work over and above, but your job should be more than punching a clock. You should actually want to engage in your job, engage in your peers and your patients and the doctors. You need to work to expand your network rather than just thinking of this as another job. The niche person. This is the person who assumes that their current job is wrong. So they keep trying a different position. They're working med surg and it's not right. So 6 months later they go to PACU. And after 6 months, they're like, this is wrong. So then they go to critical care, and then this doesn't work. They go to the ER, and they're trying to find their niche. When instead, what they're forgetting and not realizing is that every spot can be your niche if you make it your niche or niche. I'm not sure how to pronounce it. I usually say niche. You can make any job your niche or niche if you just work at it. Then the last group of people, they're the eternal students. They go out to the workforce, they get a job, they realize, I don't know if I like this so much. They go back to school. They get a BSN, and then they get a master's, and then they get, they just keep going to school. Yeah, not a great way of handling it. So, role transformation, when does it happen? Well, it actually, your transition from novice started with your first nursing class, but it really is accelerating in this last semester. You probably noticed that the instructors are backing off and not standing right over your shoulders as you do things. We don't need to be mamas to you anymore, or papas in my place. We're giving you more realistic patient care assignments, more patience, less time to prep. We want you to perform instead of observe. We want you to find real life settings. And hopefully you request experiences in your area of interest. How can you prepare for transitions? Try to think positively about everything. There's a good side to everything. Even if you have a job or a clinical experience that you really don't like, consider that a good experience for what you don't want to do later on. In my nursing school, I truly, truly hated my mental health semester. We spent a whole summer in mental health. Hated it. But I used that to guide me when I graduated to never work in mental health. Try to stay healthy, get organized, find a mentor. When you get hired at a new place, see if you can find a mentor to kind of like walk you through the minefield of the job. Do a self-assessment. Do you really like being a nurse? Are you open-minded and willing to learn new ideas? Are you comfortable with basic nursing skills with the understanding that you will be learning more and more? Do you have a good sense of humor? And good sense of humor can be all sorts of things. So a good sense of humor is not necessarily cracking jokes, but it's being able to laugh at mistakes. How do you respond to constructive criticism? Hopefully over your nursing student career, you've learned to handle constructive criticism positively. What are the rules of the road? Stop. Take care of yourself. Plan your transitions. You should be starting to plan for your NCLEX right now. You will make mistakes. So you might see a detour sign in your career. It happens. Learn from it. Get your personal life in order. You can't be the best you are on the job if your home life is messed up. I know. I've had that happen. Make sure your home life is as organized as your work life. And work on your home life too. Maintain a positive, healthy attitude. Don't burn any bridges behind you though. Even if you hate your job, when you leave, thank them for teaching you something. And take a break at some point. Take vacations. Seriously, take vacations. Take time off, and on your time off, don't hang around at home. Go somewhere, even if it's a day drive to Door County or to Chicago or wherever. Get away from home for a little while, pamper yourself, enjoy life. You work hard, enjoy life. You don't have to go on huge vacations. You don't have to go on cruises around the world or anything because, they're expensive. But my wife and I will sometimes hop in the car and we'll drive to Door County. We'll drive to Madison. It's a few hours from Green Bay. We'll hit some sites and we'll come home. Doesn't cost much except time. And it's a time spent together with my wife or my kids that really help me focus on my job when I'm on the job. What about burnout? Burnout is bad. Burnout happens to everybody at some point. It happens mostly in stressful or even dangerous work environments. Environments that have poor support or there's lack of respectful relationships. Could be getting a low pay scale, and that can be bothering you. Random shift changes, long work hours. There's so many reasons to cause burnout. Burnout also happens when you don't take those vacation days, when you don't take those days off, your personal time off, when you don't call in sick when you're actually sick. Now, if you have a cough or if you have a headache, that's not worth calling in sick for, but if you are truly sick, if you have a fever, if you've got explosive diarrhea or projectile vomiting, call in sick. Nobody wants you around. Get healthy so when you go back, you're ready to go. What are some symptoms of burnout? They are very similar to a lot of other problems. Irritability, weight changes up or down, headaches, GI disturbances, chronic fatigue or insomnia, depression, helplessness, negativity, cynicism, angry outbursts, being overly critical of yourself and others. These are all signs of burnout. If you see those in yourself, take action. What's the best thing you can do? Take a step back. Find out what's going on in your life. Are you burned out on the job because you have home stress? You can't fix the job if the home is breaking down. So find out what's going on there. Are you under stress on the job because you are understaffed and overworked? Well, what can you do about that? Immediately, not much. But you have to do what you can to protect yourself. Take a yoga class. Go for a long walk every day. Pick up a book, a novel, and read something to give you a mental break from all the stress on the job. All of this will improve your empowerment and self-care. It'll create a holistic type of self-care where that your home life and your work life are both equal. Now, I'm actually not a big fan of the phrase work-life balance. I believe that when you're at work, you should be totally at work, and when you're at home, totally at home. That's how I balance my work and home. When I'm at school, I'm at school. I don't answer home emails. I don't text people at home. I'm here. Likewise, when I'm at home, after a certain point at night, I don't answer my emails anymore. I'm done. I'm at home now. That's how I balance. That's how I keep my sanity, and I can function best both at work and home. So how do you find that work-life balance if it's there? What about friends on the job? Can you hang out with your friends after work? Sure, you can, and you probably will. But remember, if let's say everybody on your team goes out on Friday night together, what are you going to talk about? You're going to talk about work. Well, are you really getting away from work then? Oh, so you're out drinking. Well, yeah, you're out drinking, but you're still focused on work. See, that's why when with our neighborhood, there were no other nurses. There was only one guard. There was only one paramedic. So we were able to help let each other decompress, vent, and not worry about trying to. Oh, well, you think that was a bad nursing story? Well, let me tell you my bad nursing story, because that's what happens. So if you can find friends outside of work, that's really good. Maintain good nutrition. Maintain a healthy weight. That may mean losing weight. That may mean not losing any more weight. You know, I've seen students and nurses who are on the very low side in terms of healthy weight. Get good sleep. Truly, adults need 7 to 9 hours of sleep to function best. Quit smoking if you smoke. Limit alcohol consumption. They say up to two a day for men, up to 1 a day for women. And that's like for wine, a 5-ounce glass of wine, or 2 beers for men. Truly, one a day, every day, I think may even be, in my opinion, if you have a drink, one drink every day without fail, that might actually be a problem. But I'm not saying you can't drink alcohol. You just should have limits. Exercise more. You should always exercise more. And that is the end of Learning Plan 9. We'll see you in class on Friday, and have a good day.